home health aides in the home. Right now in Massachusetts, only a nurse can give medication. A family member can give medication, you can have the postal guy come in and put your eye drops in, but only a nurse can do it according to the state rules. So we have lots of instances where there are folks who have very stable conditions, medications that they're not able to administer themselves, someone who might have a patch on for pain at end of life care. Only a nurse can come out and change that patch right now. It can be very expensive. It can be very resource intensive for home health agencies and for the system. We believe that it's time again for the system to take a look at this. And in certain instances, where patients are stable, where nurses have trained the aides, where the families are comfortable, to allow that home health aide to give that pill, to change that patch, to give that medicine. This is a cost-saving measure. Again, we're all about looking at the way we deliver healthcare and finding ways to do it better, more efficiently. This allows our nurses to see more patients, to be used more efficiently. Again, nurses are always in shortage and in high demand in our area. This legislation passed the Senate last year unanimously, James.
Yep.
And got to the end game in the House of Representatives, and at the end of the session, there was so much activity around other issues that we're trying to get done. We really would like to see this legislation move fast, move quickly. I think it will be in the Committee on Public Health. I'm not sure it's been referred yet, but you'll be hearing a lot about this year from all the home health agencies in the room, as well as from the Hospice Federation, the Mass Home Care folks, the Mass Council of Home Care Aid Services. This is really a game changer, I think, for the industry, and allows nobody should have to go into a nursing home because they can't administer their own meds, and it's too expensive to get a nurse out there to give them that. And that's the fact. We do see that happening right now. Someone who can't give their own meds, doesn't have a family member to do it, and either the system will pay for it, they can't afford to get a nurse out there. No one should have to be institutionalized because they can't give meds, and that's what this is all about. So we really would like a lot of support for this bill this year. It's a scope of practice change because it changes the Nurse Practice Act, and those issues can always be controversial and difficult, but it really is important, and I think it's time for this. So you'll be hearing more from us. If you have any questions about that legislation, there are lots of nurses in the room right now who can talk to you about it, but we really would like support. That's the end of our presentation. As I said, we have plenty of agencies here from Boston, Worcester, South Shore, South Coast, Norwell, Plymouth, Greenfield. You want to talk to our home health, Lawrence agency, they may be coming by your offices today or just stay and have a few sodas left and ask some questions. Really appreciate everyone from the Home Care Alliance coming, everyone from the legislative offices coming, and we look forward to a good, busy, productive year working with you.